These procedures have been around for a while, but the greatest thing about it is that it's so wonderful for us because there's no downtime. The effects are almost immediate, and the products that we use actually are derived from our patients. So I don't know if any of you have ever heard about a ThermiVa and an O shot. And the O shot, the O stands for what you think it does stand for. But women come in every day not just want to have their bodies changed, but they want to feel better about themselves. They want their sexuality, their intimacy to be back where it was. It happens as early as 30 years old, and it goes all the way up into our ages that we're still being sexually active as menopausal and postmenopausal women. And if anything makes a woman not feel like a woman, I feel like that's the part of the intimacy part where we have vaginal dryness, maybe some uncommon leakage during intercourse when we don't want to have that, maybe just not able to achieve that big O like we did in the past. So these are some great things I want to tell you about. So first is the ThermiVa. ThermiVa is actually a radio frequency instrument that we use. And when you say that, it sounds really scary, but the instrument that we use is actually smaller than the majority of people's fingers. So it's a small instrument like this, heat on the end, and it actually just goes in and out of the vaginal canal and along with the labia. So what it does is it actually shrinks the tissue, makes the tissue look more youthful, more plump, and then it intensifies what's going on inside the vagina. It helps tighten the vaginal canal, so during intercourse there's more friction. And this is really good for women who don't yet need that surgical intervention. And then to add an O shot onto that, so the O shot really gets you going. It helps with mild incontinence. It helps with those orgasms. It helps with sensitivity in there. It's where we actually just draw your blood, spin it down, and inject it back inside the vagina. So two things I want you to really be thinking about: a ThermiVa and an O shot, or the Thermi-O as we call it here at Decay of Women's Health.